Welcome back, viewers, to Faith and Discipline podcast. Our topic today is growth and puberty related issues in children. And our guest is Dr. Imran Zamir. He is a consultant pediatric endocrinologist. Welcome, Dr. Imran Zamir, to Faith and Discipline podcast.
Thank you for inviting me.
Let's make a start. Our first question is how do we describe growth and what are the issues related to the growth?
Yeah, so growth is a term used in children to describe their gain in height, and the process starts before a child is born. So in the tummy, baby is forming, and the growth is started there. When the baby is born, a lot of people ask that what is the quickest phase of our growth, and that's a bit of a tricky answer, but the maximum growth happens before the baby comes to this world. And after that, children go through different phases of growth. We know that they grow very quickly in the first 1 to 2 years. Then there's a slow growth until they have a growth spurt around puberty, and then they stop growing, which we call completion of growth, which is linked with the completion of puberty.
So what are the factors that are linked to growth?
There are many factors which play some role in defining that what will be our height, and like many other genetic factors, so it is linked with our parents first. So that means our genes, which we inherit equally from our mother side and father side. But it's not a single gene which defines height, so there will be many genes, and that's why there's a variation even you see between the siblings, that they have a different height. The other thing is gender is important. So we see that men are usually taller than women, and the reason is because the girls go through puberty early, so they finish their growth early, as I said before, with the completion of their puberty, while boys go through puberty a bit later than girls. On average is usually 2 years later, and that's why the boys have this advantage of keep growing for another 2 to 3 years, and that's why they ended up taller than girls. It's not that otherwise the same genes which they carry from mom and dad, but it gives boys a bit advantage to be taller than girls.
Okay, so which means boys has longer time span to grow, so that's why they grow.
Yes.
Okay. My question is, before the puberty, are there any factors like diet or what mother is taking while she's pregnant, and when the baby is born, certain type of food we can give which has all the nutritions, then baby can grow well, and if we don't do that, then the baby might have issues with the growth in the future?
Yes, you mentioned the most important factor. Actually, a lot of people think about hormones and different other factors, but the most important factor in the first few years before baby is born and in the first 2 years is the diet. So nutrition defines the pace of growth in the first few years, and inside the tummy also the baby's growth is linked to the environmental factors, mother's stress, and as well as mother's diet, and other if mom has got any medical condition, and especially on any medication, and we also know smoking, and those one of the most common cause of small babies is maternal smoking, when there's no other underlying problem with the baby. So those all factors before birth are definitely very important, that how baby grows inside the tummy. And after birth, as you said, in the first couple of years, the most common and most important factor for growth is the diet and food, and a balanced diet. But after that, the hormonal factors also started playing a bit bigger role. Here I would like to tell you one important and interesting fact is that humans are a bit unique compared to all other living creatures in the world, in the universe, that the growth is not only for humans, plants and animals also grow, and the growth factors are similar. What makes humans different from the other living things is that we have this pause of puberty, which means that when a baby is born, they have a certain initial development for puberty for the first 1 to 2 years, and after that we call it childhood. That childhood phase is missing in animals and plants. So they have a continuous growth of body and the puberty, and they reach the final stage, while humans have almost no progress or very little progress with the puberty from a couple of years of age until they start a puberty process, which is usually around 9 to 10 years for girls and 10 to 12 years for boys, and this, because of this pause, they have a very slow growth, which is childhood growth, and then they go through growth spurt around puberty.
Okay. So you mentioned puberty here quite a few times. How strong is the link between the puberty and the growth? How does it affect?
As I mentioned, that a lot of people call it growth spurt, and most people see that the parents observe that the children suddenly offshoot, and they have suddenly change in clothes size, and especially one thing which actually sometimes defines is the sudden change in the shoe size. So you see that because obviously the feet are growing with the body growth, and that's when it's changing suddenly in 1 year, that means they have gone through growth spurt, and that happens around puberty time.
What are the symptoms of early puberty? Because that's like some children, they go through early puberty and the parents are not aware why it's happening and what they can do about it. So we need to first of all understand what are the symptoms.
Yes, that's an important question, because a lot of people confuse, and we see a lot of children referred to us from primary care, as well as parents presenting to the hospital or going to the GP asking for a referral, and the most of the time people get worried about the body hairs. I'm not saying that you should ignore that, but the body hairs are not a sign of puberty, because it's defined by some other factors, especially in the side of the tummy. There are glands called adrenals, which are next to the kidneys, and they secrete some hormones which can make the body hair appear earlier in the genital area and in the armpits. But the puberty in girls is when they start with breast development. So if a girl not started breast development, that's not true puberty. Okay. And in boys, it is the change in the size of the testicles, which are the obviously the balls in the genital area, and when it's not easy to obviously notice that by parents in boys, but the other things which people obviously notice and gives you some indication that it could be puberty is sudden mood changes and temper tantrums, which obviously you see in children, but when it starts happening around in 10-11 years of age, then it's a sign of puberty. Then also having pimples and acne appearing, and one thing in boys is a sudden change in voice, so deepening of the voice, which is high-pitched voice, which it changes to the more deeper voice. That is effect of the puberty hormones in boys.
Okay, so we talked about early puberty, but there are certain people, or we can even call patients, who come to hospital with issues with the delayed puberty, and because children are concerned, and then they tell the parents, and the parents are obviously a bit worried, like why the child has not gone through the puberty, because they passed through that age. So what's the reason for that, and what's the symptoms?
The delayed puberty, again, the age will be different for boys and girls. At present, in UK, we is also like to mention here that it's defined by the geography and the area you live, and also to some extent, obviously, the genetic factors are different in different population groups. So it will be different in whites, Africans, and Asians. So because obviously genetic makeup is different, and the early puberty in girls in UK is when they start with the breast development before 8 years of age, while boys having signs of puberty, which is a change in size of the testicles before 9 years of age, is called early puberty, which needs further investigation. So other extreme is the delayed puberty. So in girls, again, most of the time people understand is about starting the periods, but periods will be the end of the pubertal development. So if the girls have not started breast development by 13 years of age, then that's a late puberty. And in the boys, same, is not having any change in the size of testicles by 14 years of age, we call it late puberty. The interesting fact also is here is that early puberty in girls without any underlying cause or any problem is more common, while early puberty in boys is less common and more likely to be problematic, while late puberty in boys is more common and late puberty in girls is less common. So that means when it is less common means that you're more likely to have underlying reason for those which need to be investigated.
Okay. So what are the reasons why there is an early puberty and why there is a delayed one? Why is it not happens on the right time?
We have to do investigations, which includes obviously taking a full detailed history, examining, and then doing some investigations. And the reasons are variable. And as I said, sometimes you don't find any underlying reason, and you just, but still, we have to continue to follow them, monitor them, and if they make the progress according to the expectation and they achieve the final stage without any other issues appearing. Because sometimes you may not find the reason immediately, but by keeping follow-up for a couple of years, you will find the reason. As I said, I don't want to scare people, but obviously we have to think about the more serious causes first, and the serious causes will be the tumors. And the tumors could be either of the genital organs, or it could be of the brain, because the brain is the one which controls the hormone production which trigger puberty. So if there is any growth in the glands which trigger the puberty in brain, it is pituitary, but it may not be tumor of pituitary itself. It could be tumors around pituitary, which, because in brain most of the tumors are not cancers. But because it's such an important organ, if there is a growth there which is putting a pressure on the other organs, then it will affect the function of the glands there. So that's why pituitary gland could be affected because of the pressure from the surrounding areas.
Okay. So if unfortunately someone has the problem, like they go through early or late delayed puberty, is there any like mental health issues related to that? People do get like mental health issues like anxiety, or they might get depressed why their body is not forming how it's supposed to be. Is there any link?
Yes, actually that's probably one of the main reasons that we recommend treatment. There is obviously reason when somebody comes to us with early puberty, and we discuss with them after investigation that if we don't find any underlying reason, we offer the options to delay, or we call it pause the puberty. So obviously there's a limit how much you want to delay it. You don't want to delay fully, and the reason is that when a child goes through puberty, there is a certain skeletal development happens and muscular development happens, which is essential to happen at that stage. So if you delay it forever or delay it for too long, then that maturation will not happen at the right time, which will have effects in later life. And one of the important thing is makes the bones weak, so the increased risk of fractures or what we call it osteoporosis in later life. So the reasons for what your question was about the emotional support and obviously effect is a huge huge. If you can imagine a girl, if they start periods when they are in year 3 or year 4 in primary school, then one thing is whether they will be able to cope with it. The other thing is the effect of bullying from the other children, and also the child will feel that why I look different from the rest. So that's why we offer treatment, as well as what I mentioned you before, that because starting puberty means they also will stop growing. So that child has slightly risk of being shorter than the other children if they start puberty early. So that's why we offer treatment one thing is to improve the height gain, and the second thing is to give them time so that they have a less effect on their emotional health, and they will reach a stage where they'll be able to cope better, and also most other children of their age group will be going through the same changes.
Okay. So what are the treatment options available for early puberty in boys and girls both?
It is similar, as I said before, that what the reason why humans have a pause and suddenly they go through puberty is some hormones in the brain. They actually are released throughout the obviously through the ages in boys and girls. But what happens around puberty, that those hormone release becomes more cyclical, and we call it circadian. That means the hormone release is different at night time and daytime. Okay. So when this change happens, that has a different effect on the organs in the tummy. In case of girls is ovaries, and in boys in testes, which makes them grow in size. And there is some treatments available. What we normally prefer is our injection forms, and that are synthetic hormones which block this hormone release from the brain, and that will delay the further progress with the puberty. And once we stop it, then it doesn't mean that it will start straight away, but then it can take from 6 months to a couple of years before the cycle will start again.
Okay. So if you use hormones to delay the puberty, but if the puberty is already delayed, then how do you expedite the process of puberty?
First thing will be to find the cause and the investigations, and as I said before about the tumor, so that's the most important serious cause. We'll have to do the relevant investigation, which might involve some scans. It could be ultrasound scan or CT scan or MRI scan of the brain. Then it will involve some hormonal test, and in girls one of the cause obviously could be that the ovaries not fully developed, or some organs missing, and one of the important other tests is, we call it chromosome test, to find out that they carry the normal number of sex chromosomes, which in boys is XY and in girls is XX. But there are many variations of these chromosomes which are possible, and in that case it will affect the puberty, and usually will be delaying the puberty.
So what parents can do if child is going through these issues, early or delayed puberty? What is parents' role? How can they help in this situation?
First of all is obviously what we're doing today is awareness. So they need to be aware of that how the body develops and changes, and I think it's important for all parents to know this and see if they're going through the changes at the right age. And if they think that they are worried about the changes happening earlier than expected or later than expected, then obviously to identify those symptoms and seek medical help at the right age and right time. And then obviously it will be, if they are attending the clinic appointments, then to support them at that point. And I think it's a shared decision making is very important, where we in a pediatrician world world, we always take parents' opinions and views on board, and we call it shared decision making. But children, sometimes obviously, if in the clinic are depends on their every child is not similar and may not be able to express themselves, so they need support from their parents. So it's not that if a child has got a view on a certain thing, they should be able to take that on board and support them accordingly.
Okay, so that's parents' role in it. But what about the child? Because not every child is same. Some are more outspoken, they are more confident, they have good relationship with the parents and they can speak to them openly. What if the children are a bit embarrassed to talk openly? Who they can speak to?
I think the children's, other than parents, their interaction on day-to-day basis is with the teachers, and teachers in this country are very aware of these things, and part of that curriculum they also talk about the growth. And in primary school there is a growth program going on for the last few years, and they do identify shorter children, and we do come across where the parents, it's not parents, it's the teachers who have told parents that probably your child need to be seen by the doctor because they are not growing appropriately or they are having some body changes. The other thing is, I think, as you said, it will be very difficult to obviously reach children directly, but children always share with their obviously friends, but probably their friends will be in the similar situation. They won't be able to always communicate because but I think as a parents we should have a good healthy relationship with our children, and we should pay some attention to these aspects.
Okay. But there is another point I want to bring to the conversation is role of the internet, the media. Is in the past when the internet was not widely available, then kids used to go to other similar their peers, same age group, and try to find the solution of the problems. And the clever one might be the ringleader and try to tell like, oh, you might have this issue and what to do. But now everyone has access to internet. The kids can go internet and they can search anything, and internet is full of information and disinformation. So in this context, for the children, what is your message, and for the parents obviously as well, how they can go to the right place for the right information? Because if they follow the misinformation, then it might harm their bodies, or it might harm their growth as well.
I think you have brought the very good important aspect, and in this aspect I think if you Google it or if you use some you probably will come across more disinformation than information. So there is if you find a Department of Health website or if you find NHS website, yes, please take that message, but any other websites very, very difficult for me to recommend. And also I know that these are the phrases, if you put in internet, you will come across many websites which you don't want your children to see. So I will say that strictly on these topics which we are discussing today, only follow any advice which are from the authentic government websites. Any other websites might give you more information which is not trustworthy and probably not even relevant.
Okay. So what are the we discussed puberty. Now we go back to our initial point to the growth. Is like we were discussing the growth of the children. If the child has a short stature and the parents are a bit concerned that the kid is not growing as it's supposed to as compared to other peers, what can they do? What are the treatment options available?
Short stature is one important condition which can cause a lot of psychological effects on children, and we see some children brought to us and they are bullied and they are worried a lot because they're saying they are shorter than their friends, and we see that more often in boys, but as I said, it's a thorough examination and workup is required, and parents parents' first thing is to support them and not to be dismissive and seek medical help. We never say that a short stature is normal, so we always have to investigate. But then the treatment option will depend on the cause. You can't treat somebody blindly without knowing that what's going on. And as I said, it's important to know the height of the mom and dad, because that will define the genetic potential for the child. So that's the first important factor. Then, as I said, it will be depending on the growth phase, that where are the children, at what stage of growth they are. Like if they are not gone through puberty yet, that means they might be just a bit behind, and they will catch up. And we see a lot of those children that they are short, and we don't have to do anything, and they have growth spurt much later than the other children, and they end up even taller than their friends. But then there are some hormonal causes, and in younger children, the most important hormone which again helps with the growth is the thyroid hormone. So if you have underactive thyroid, that can cause short stature. And then you'll have to find out if there's any underlying other causes which can also affect the growth. And because what we mentioned about the diet, so it could be a good diet, but if the nutrients are not absorbed in the body, and so if there is a condition like a celiac where the gut is inflamed, so you're eating healthy but it's not absorbed in the body, so that can cause short stature. Similar is Crohn's disease, ulcerative colitis, cystic fibrosis. So there are conditions from like could be related to chest in other context, and relatively less common in this country, but still it's not uncommon, is a tuberculosis. You know that if the children get tuberculosis as one condition, it will affect the growth. And there are many other conditions. The last and the least I would like to mention is the growth hormone deficiency as well, which people think, but it's not as common as other things which I mentioned already.
Okay. So what if parents decide to go down that route? They want their kids to have the growth hormone, because they feel quite desperate about it. So is it safe to use growth hormones?
It's important, because many people come and ask that can you not give our child growth hormone because it's short, because it's just a name. Growth hormone means that it will make you grow, but that's not true, because growth hormone will make you grow only if you have a growth hormone deficiency. If your child is not growth hormone deficient, then it might give you more serious side effects. Saying that there are few conditions where growth hormone is licensed, and those conditions don't have growth hormone deficiency, but those are rare, and there are conditions which many other problems as well. So in a normal child without any other problems and not having proven growth hormone deficiency, we call it idiopathic short stature. There are some countries in the world where they have tried giving growth hormone and still give it, but there is obviously a lot of risk attached to it. So in UK, we normally don't recommend and don't start growth hormone for idiopathic short stature, except where like sometime with a short trial under a very strict control environment, we can give it. But still, in my experience and in our department, the results are not very convincing, and usually it doesn't make much difference.
Okay. If they don't make any difference, but have you seen anyone like taking these hormones and it cause any side effects, anything which undesired side effects?
Yes, thankfully they are rare, but there are obviously side effects, and the side effects can be very serious. The most important side effects, again, not reported that often in children, but adults also take growth hormone. Growth hormone also, if you probably are aware, is a illicit drug of abuse, especially used for performance enhancing, and if somebody is taking growth hormone, they are banned to participate in competitive sports like Olympics and higher level, unless there's a special category for it. And there it causes increase, as will increase the growth of the cells. It will cause cancers. So we normally say that growth hormone doesn't cause cancer itself, but if your body has got a potential to develop cancer, it will precipitate it. So the cancer will appear sooner. But more common side effects which we see, it causes curved spine, so it causes scoliosis. Because of rapid growth, the hip joints can come out of the socket, so it causes the hip dislocations. It can also increase the pressure inside the head, and can cause severe headaches. But these side effects are mostly seen in people who are taking growth hormone without growth hormone deficiency.
Okay, right. Okay, thank you very much, Dr. Zamir. I hope our viewers have found this information useful, and thanks for joining us today.
Thank you very much.
Thanks, viewers. If you found this episode useful, you can like and share and subscribe to your friends and family. If you haven't already, please make sure to subscribe to this channel. Thank you.